circumstance and why you hurt with a kidney stone is because that stone is blocking the tube. I think there's a general misconception that people think the kidney stone and the movement of that stone is what hurts. It's actually the obstruction that's hurting you. It's the stretch within the system that makes that uncomfortable and consequently gives you the pain. So in order to alleviate that pain, the intervention obviously is to eliminate that obstruction. So we do that in multiple different ways, but in essence, lithotripsy is one of the main. And lithotripsy is in essence just a doctor word for fragmenting a stone and making it into small pieces. You can do that with shockwave lithotripsy, which is a non-invasive approach where there is a shock initiator that's placed onto the skin that ultimately creates energy and fragments the stone into smaller pieces, small enough to make them pass, or allow them to pass, I should say. Then there's also laser lithotripsy, where a small telescope can be inserted into the bladder, up and into the ureter or the tube that drains the kidney where the stone is obstructing. You then use a laser to fragment that stone into small pieces. Although most people don't like the idea of having a telescope placed inside, the clearance rate is generally better because not only do you fragment those stones with a laser, but then you pull them out too. So lithotripsy, in essence, making the big stone into a smaller stone, is the mainstay of therapy when you're dealing with surgical treatments for stone disease.